Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about scar tissue massage and go over a couple of strategies and techniques for doing scar tissue massage effectively. So today we're talking about scar tissue massage. This is, of course, an important technique for helping to manage your scar, manage your incision after knee replacement surgery. When it comes to what the look and appearance of your scar is going to be, a lot of it is going to boil down to genetics. So there's a lot of it is just the makeup of your body and how your body manages and deals with scar tissue. So if you've maybe had a surgery in the past, a close relative of a parent or a sibling who's had surgery, maybe that can give you a good idea, but really it's going to come down to your genetics. And a lot of it in terms of going from that red, that deep red purple look, that kind of raised look of the scar, to more of that better looking, more kind of clear, smooth, almost skin tone look to the scar. It's really going to be a matter of just giving it time for the tissue to heal and for that remodeling phase of tissue healing. So the new collagen is laying down and remodeling and healing the area. And this can take up to 2 years to complete. So really giving it time is going to be your best thing. But there has been some benefits, or there supposedly is some benefits with scar tissue massage. There's not a ton of great research. It's kind of inconclusive. It's hard to quantify something such as appearance of a scar, but it seems to be that with scar tissue massage, people report better comfort, better tolerance of different activities, different bending of the knee, a little bit more mobility of that tissue. And people also report overall it tends to help, they believe, or it seems to be, with the appearance of the scar as well. So basically what you're doing with scar tissue massage is, first you want to wait a couple weeks after surgery. So you want to let that tissue, let the incision go through those first stages of healing. You don't want it to be a wound. You don't want it to be a scar anymore, a scab anymore. You really want it to be in that phase of just being a scar tissue. And at that point, you're going to want to have a lotion or an oil or a cream, something obviously that is made for applying to your skin and using for gentle massage techniques. Anything with vitamin E in it, such as coconut oils or a coconut cream. Vitamin E is supposedly supposed to help with collagen repair, collagen healing, tissue healing. So that may have some added benefit if you can find anything with vitamin E in it. Again, there's not great research to support this one way or the other, but very safe to give it a try. And all you're going to do with any type of scar tissue massage is, one, you want to focus on a firm pressure, firm but comfortable. Shouldn't be overly painful, shouldn't be aggravating, but it also can't be too soft that you're really not doing anything. So kind of a firm pressure to the area. You're going to want to focus on both the incision and the scar itself, and then also the surrounding area around the scar. So the tissues and the skin and the areas around the scar, improving kind of the mobility and the elasticity of that area as well. And typically, what you want to do is just kind of very firm pressure, repeated motions to an area. So repeated circles with the pad of your thumb. You can do the pads of your fingers. You can do circles. You can do up and down. You can do side to side. You can do more broad along the whole length of the scar, or you can focus on a particular area. And really you want to spend maybe 3 to 5 minutes total doing this. And in the early phases, it can be potentially good to do a couple times a day, 2 or 3 times a day. After that, you can really start to decrease it to maybe once a day, once every other day that you're doing this. Again, this is kind of a supplement, an addition. Basically the thing that's going to give you the best healing and the best chance of it looking better is going to be giving it time, and hopefully that you have the good genetics and the good makeup of your body that helps the wound and the tissue look better. But this is a good kind of adjunct, the scar tissue massage, and it can really help with kind of people who might have a little bit of that discomfort with certain exercises like bending, or just that sensitization of that area. It can help kind of calm down and decrease that sensitization by doing the scar tissue massage as well. So get a lotion, get a cream that's good and you can apply to the skin. If it has vitamin E, that's a plus. Focus on maybe 3 to 5 minutes of that firm but comfortable pressure all around the incision and the tissue surrounding the scar and the incision as well. So that's scar tissue massage. I'm Dr. Luke Peterson, physical therapist with the Knee Replacement Therapist. Thank you very much for watching, everyone, and have a great day.